Bacterial infections can interrupt life in more ways than one. That's why healthcare professionals continue to trust a well-known treatment, amoxicillin, a penicillin-class antibiotic that destroys bacteria by weakening the cell wall, leading to cell death. Effective, dependable, and used for decades. Before we meet our first patient, let's take a look at what amoxicillin actually does inside the body. After you swallow a dose, amoxicillin is absorbed through the small intestine and enters the bloodstream. From there, it travels throughout the body until it reaches the site of infection. Once it finds the bacteria, amoxicillin attaches to proteins in the bacterial cell wall. This prevents the bacteria from building a strong cell wall, something they need to survive. Without that protection, the bacteria weaken, burst, and eventually die. That's how amoxicillin stops the infection and helps the body heal. Now that we know what amoxicillin actually does inside the body, let's meet our patient.
Hi, is this Emily?
Yes.
Perfect. I'm your nurse today. Can you tell me what's going on with you today?
Yeah, I've been sick for a week, coughing, fever, and my throat felt like sandpaper. I knew something wasn't right.
Perfect. Let's take a look. Based on your symptoms in your exam that you had earlier, it looks like you have a bacterial infection, likely affecting your respiratory tract. Amoxicillin is one of our first choices because it works against the spectrum of gram-positive and gram-negative bacteria.
Okay.
Amoxicillin is commonly prescribed for respiratory infections, ear and throat infections, urinary tract infections, and even gastrointestinal infections caused by H. pylori.
I just want to make sure you know how to take this medication safely. First, always tell us if you ever had an allergy to penicillin.
No allergies that I know of.
Perfect. Some people may experience mild side effects like nausea or diarrhea. Very rarely, allergic reactions can happen. Things like hives, rashes, or difficulty breathing. If you notice something severe, please contact us immediately.
Okay.
Your provider will also monitor for complications like severe diarrhea, which might signal a more serious issue like C. diff infection.
Hi, I'm here to pick up my prescription for amoxicillin.
Of course, here's your medication. If it's a liquid suspension, shake it well before each use, refrigerate it, and discard any leftover portions after 14 days.
Okay.
Certain medications can interact with amoxicillin. Drugs like probenecid can increase its levels, while oral contraceptives may become less effective. If you take anticoagulants or methotrexate, always inform your provider.
If you're using it as a birth control pill, use a backup contraceptive while on this medication, as it may not be effective. Thank you. You're welcome.
I set reminders so I can take each dose at the same time every day. Within a couple of days, I started noticing improvement. Less fever, clear breathing, and my energy started returning. This is how amoxicillin works best. Taken on schedule, evenly spaced, and completed in full. Skipping doses or stopping early can lead to antibiotic resistance or returning infection.
You're looking much better today. Your symptoms are resolving, which tells me the medication is doing its job.
I'm glad I followed the instructions. I feel like myself again.
Amoxicillin isn't for viral illnesses, and it should only be used when prescribed by a healthcare provider. But when bacterial infections take hold, this medication has a long-standing record of effectiveness and safety.
Amoxicillin, trusted care for bacterial infections.